Hi, my name's Sehba Singer. I work at Salt Lake Behavioral Health, specifically in the Strong Hope Military Treatment Program. We work with folks who have PTSD, and I'm going to share a little bit of information that I often get asked in the context of PTSD and in the context of the treatment of PTSD. One of the questions that we get asked very frequently is, what is PTSD? Certainly we have folks that come into the program that have received that diagnosis by a provider back at their duty station, and it's not often clear to them what exactly it means as far as symptoms and as far as consequences that it's had in their life experiences. So PTSD, I think many people are aware, is post-traumatic stress disorder, and it inevitably requires exposure to trauma. That exposure can be direct exposure, meaning that you've incurred the trauma yourself. It can be having witnessed the trauma, meaning you've experienced or watched someone else be victimized or hurt in a particular way. It can involve learning about a trauma, so knowing that something terrible happened to a family member or a close friend. And certainly one of the last criteria or categories is vicarious trauma. And so that would be something that's experienced by therapists or first responders. We see that frequently, in the medics that we work with and the folks that work in the healthcare profession. So one of the other frequent questions that we get is, what are the symptoms of PTSD? It's not always clear to people how their symptoms are showing up, what those symptoms are, and how they're contributing to potential dysfunction that they're experiencing in their lives. There's 4 symptom categories that we look at when we are looking at DSM-5 criteria for PTSD, but inevitably one has to have had an exposure to trauma. The 4 other symptom categories involve re-experiencing symptoms. Re-experiencing symptoms are really a pretty wide range of symptoms, but they inevitably involve having an experience that is indicative of or similar to something that has been evoked as a consequence of your trauma. So that could be nightmares, that could be triggers throughout the day that you might have in consequence to the trauma. It could be intrusive thoughts that you have, so just thoughts that pop up randomly throughout the day that might involve literal representation of the trauma or memory of the trauma. And certainly also flashbacks, which involve losing orientation in space and time, and certainly feeling as though the trauma is actually occurring in the moment that you are in. Then other symptom categories include hyperarousal symptoms. That's, I think, a really has been really popularized. It's the hypervigilance, it's the fear that something bad's going to happen, and it's just kind of always waiting for the next negative thing to kind of show up or pop up in your life. I think that's, again, been popularized a lot in movies, and it's a really common symptom category that most people are aware of. Hyperarousal also shows up in the context of insomnia, anxiety, and just a lot of mood instability. That is also kind of, all these symptom categories play off of each other and play into each other, most certainly. And so, as a consequence of some of the hyperarousal symptoms and the dysregulation of our nervous system, and just, again, the disruption that causes to our mood, we experience, an additional symptom category, which is the negative emotion and affect. And that certainly involves depressive symptoms. It can involve changes in our thought process. So we start seeing the world really negatively. We start experiencing a lot of maladaptive beliefs about ourselves, other people. We are compromised as far as our trust in self and others. We're compromised as far as feelings of safety and beliefs around our safety. We start to struggle with feelings of power and control, feeling as though we don't have any, and or other people have all the power and control. We certainly start developing negative beliefs or feelings around intimacy, whether that be emotional and or physical. And we also start to struggle with just an overall inability of mistrust. And again, that's in self and certainly in others. And so that obviously can lead to some pretty problematic issues in the context of being out in the world, feeling safe in the world, and also feeling safe in the context of our homes and in our relationships and with our families, which is why we often see people struggling relationally as they come into our program and as they move through this process. The last symptom category, and certainly I didn't go through these symptom categories in the order in which they show up in the DSM, but the last symptom category, and probably the most important symptom category, is the avoidance symptoms. And this symptom category actually perpetuates all other symptoms of PTSD. And avoidance is essentially the idea that as human beings, we are not hardwired to move towards pain and distress. And so in the context of trauma, we move away from thoughts associated with trauma, we move away from feelings associated with trauma, and we certainly move away from anything that actually reminds us of the trauma directly. And as you can imagine, if we're avoiding all of these things, it doesn't really give us the opportunity to ever actually engage with the feelings that we have, and it doesn't ever offer us the opportunity towards moving to a restorative and or healing experience around the trauma. So the benefits of treatment, and I would say specifically of treatment at Strong Hope, are that we work to help you regain connection with self and others, and we also work to move you from a disempowered stance to a stance of empowerment and understanding. So a lot of folks come into this process, not understanding what they're experiencing, not having had the appropriate psychoeducation around why they're feeling the way that they are, and that can make us feel like we have less control, no control, or totally powerless, which all contribute to even greater, symptomology in regards to the PTSD. And so our objective here is to provide our folks with psychoeducation so that they understand what they're experiencing and why they're feeling and responding the way that they are. We help them identify how they've been affected in the 5 core areas that human beings are compromised as a consequence of trauma. And those 5 core areas are safety, trust, power and control, self-esteem, and intimacy. And that's really important to understand how, as a consequence of trauma, we've acquired maladaptive beliefs about ourselves in those realms so that we can work to, change, not necessarily, ideally changing those beliefs, right? But even just understanding that they're there and understanding what's prompted them and why we feel the way that we do.